Proposed study schedule for NCLEX preparation over 1 month, prioritizing daily practice questions and answers. The plan highlights a range of nursing subjects, practice exams, and explanations to solidify comprehension and test-taking tactics. Week 1, Core Content Review. Days 1 to 3, Medical Surgical Nursing. Focus, Cardiovascular, Respiratory, Neurological Systems. Goal, review key concepts and conditions, such as heart failure, asthma, stroke, and electrolyte imbalances. Practice, 75 to 100 questions per day from these systems, reviewing rationales. Days 4 to 5, Pediatric Nursing. Focus, developmental milestones, common pediatric diseases, e.g., asthma, diabetes. Practice, 75 to 100 pediatric NCLEX questions daily. Review rationales to understand key concepts. Day 6, Maternity and Women's Health. Focus, labor and delivery, postpartum care, prenatal care, and complications. Practice, 75 to 100 maternity questions. Pay close attention to fetal heart monitoring and stages of labor. Day 7, Review and Self-Assessment. Practice, 100 questions from all content areas covered so far. Goal, identify strengths and weaknesses to focus on for next week. Days 8 to 9, Pharmacology. Focus, common medication classes, side effects, contraindications, and nursing interventions. Practice, 75 to 100 pharmacology questions daily. Pay special attention to drug endings and patient education. Days 10 to 11, Psychosocial Integrity and Mental Health Nursing. Focus, mental health disorders, e.g., depression, schizophrenia, therapeutic communication, crisis intervention. Practice, 75 to 100 mental health NCLEX questions daily. Focus on patient scenarios requiring prioritization of care. Day 12, Fundamentals of Nursing and Infection Control. Focus, safety and infection control, basic care and comfort, nutrition, and mobility. Practice, 75 to 100 fundamentals questions. Review infection control measures, e.g., PPE usage. Day 13, Health Promotion and Maintenance. Focus, growth and development stages, preventive care, screening tests. Practice, 75 to 100 questions on these topics, emphasizing anticipatory guidance. Day 14, Review and Self-Assessment. Practice, 100 questions from all topics covered in the week. Goal, practice prioritization, e.g., Maslow's hierarchy, ABCs, airway, breathing, circulation. Week 3, Practice tests and review weak areas. Days 15 to 16, Full-length practice tests. Practice, take 1 full-length practice test each day, 75 to 145 questions. Review rationales thoroughly to understand mistakes and weak areas. Days 17 to 18, Maternal Child and Pediatric Nursing Review. Review any weak areas identified in practice tests. Practice, 75 to 100 questions each day on maternity and pediatric topics. Days 19 to 20, Pharmacology Deep Dive. Review medication calculations, high-alert medications, and patient safety. Practice, 75 to 100 pharmacology questions focusing on calculations and medication administration safety. Day 21, Review and Self-Assessment. Practice, 100 questions covering all topics, emphasizing prioritization and delegation. Week 4, Final Preparation and Strategy. Days 22 to 23, Management of Care and Prioritization. Practice, 75 to 100 questions on delegation, prioritization, and leadership in nursing. Focus, NCLEX strategy. Identify what the question is asking and use elimination techniques. Days 24 to 25, Simulation and Comprehensive Review. Practice, take 1 to 2 full-length simulated NCLEX tests. Goal, simulate the test environment, time yourself, reduce distractions, to build stamina and confidence. Day 26, Content Review of Weak Areas. Focus, review any remaining weak areas, especially those identified in practice exams. Practice, 50 to 75 questions on those topics. Days 27 to 28, Relaxation and Light Review. Practice, light review of flashcards, notes, or mobile app practice questions. Focus, keep anxiety low, and focus on positive affirmations and confidence building. Day 29, Final Practice Test. Practice, take 1 final full-length practice test to assess readiness and stamina. Day 30, Relax and prepare for test day. Avoid intensive studying. Focus on calming activities, good sleep, and preparing necessary items for test day.